This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning, everybody. I was going to talk for a minute about a couple things about airway management in morbidly obese patients. So obviously, morbidly obese patients present several challenges in care in the emergency department, but airway management can be one of the kind of most significant issues. So, if there's a decision that, we do need to intubate somebody, one of the first things we should be thinking about is positioning. Positioning in all patients for airway can be something to consider, but it's extremely important in the morbidly obese. And I don't know if people have heard of the idea of ear to sternal notch. So if you have somebody who's morbidly obese and is laying flat on their back, their chest is like way above their head. And it's going to be essentially impossible to get them intubated or ventilated in that position. Just you cannot kind of get a tube in. So what needs to happen is, if you can imagine someone laying on their side, you want to line up the whole of their ear, their auditory canal, with the top of their sternum, their sternal notch. And the way to do that is with a lot of blankets, like all the blankets in the emergency department. And you need to just get lots of blankets, and, someone needs to kind of lift them up a little bit, and you start ramping up their shoulders, their back, and then you basically need to lift up their kind of top of their upper back until their head is close to where their sternal notch is. And then you want to get a couple extra blankets to get their head kind of parallel to the ceiling. So, if you need to Google it, it's a good thing to take a look at, but it's really, really important to get that position. It makes intubation of these, very challenging patients much more reasonable. So that's kind of the first thing, is even as we're even thinking about it, if we're starting to get them pre-oxygenated, getting that positioning, and it takes several people a lot of times to get that done, but it's extremely important to get that ear to sternal notch positioning. That's probably the most important thing. A couple other things, BiPAP can be very, very helpful in getting the people pre-oxygenated while we're getting ready to intubate them, because, they have a huge chest, difficult to ventilate. So BiPAP can be very helpful. Another thing is dosing of paralytics when we get to that point. It's a little controversial. Succinylcholine is probably dosed on total body weight, so it's going to be huge doses of succinylcholine, so be kind of ready for that. Rocuronium, some people dose on total, some people dose on ideal, but it's going to be more. We're going to need several vials of probably succinylcholine or rock in either case. And then the last thing is, when we have our BVM set up, we need to reoxygenate. A PEEP valve on these people is extremely important. PEEP valves are really nice on everyone we're using a BVM, but on morbidly obese patients, like a bag valve mask is going to be almost worthless if you don't have a PEEP valve, because of just the extra resistance because of their weight. So ear to sternal notch, dosing of paralytics, BiPAP, and then PEEP valve on the bag valve mask. A couple things that we can do taking care of these people. Any questions, comments? All right, thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.